Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. Although we've been predicting and expecting this dramatic increase in COVID-19 cases, it's still very difficult to see case numbers increasing so rapidly. We've shifted gears very quickly, changing how we test for COVID, how we follow up cases, dramatically increasing our vaccination capacity, and changing the rules on how we gather in Ontario. The Omicron variant is much more transmissible than anything we've seen before. It's already the dominant variant in Ontario, and according to the Science Table's recent modeling, this could be the most challenging wave yet in the pandemic. We knew from the start that this was going to be a marathon, and the last few kilometers of a marathon are by far the hardest. This is what we may be experiencing right now. Though Omicron may cause milder illness among the vaccinated, with the sheer number of cases that we are expecting, and with it being so much more easily transmissible, we are very concerned that hospitals and ICU capacity could become overwhelmed. Our overall goal is to prevent this rapid surge and to protect hospital capacity by slowing the spread of the disease. Omicron will push COVID-19 cases to new heights, even by midweek this week. We know that the risk of severe illness is dramatically higher in our unvaccinated, and the risk increases with age. For this reason, our first priority for vaccination right now are boosters for residents age 70 plus, age 50 plus, or the immunocompromised, as well as residents who've not yet received their first or second doses. Booster doses will continue to expand to age 18 plus in York Region once we're able to meet the demand among those the most vulnerable, who are the 50 plus population. This is an ethical imperative. Expanding eligibility to age 18 plus and shortening the interval between doses has brought the number of individuals eligible for a booster to over 700,000 individuals in York Region. We also have approximately 60,000 York Region children aged 5 to 11 that still need to receive their first dose of the COVID-19 vaccine. That's a lot of vaccine to administer and not a lot of time. We've been working diligently with internal and community partners in York Region, and we're thankful for our local municipalities who've been incredibly helpful in assisting us set up additional mass vaccination clinics as quickly as we possibly can. Since receiving the news of increased booster availability just last week, we have doubled our capacity. With support from our partners, we look forward to continuing to increase our capacity even further and make sure we have all of the extra resources we need. Eligible individuals who require the COVID-19 booster must make an appointment by visiting york.ca/COVID-19 vaccine or by calling Access York at 1-877-464-9675. Only individuals seeking first or second doses may walk in for a COVID-19 vaccination. Due to high demand, York Region clinics are not accepting walk-ins for third or booster doses. Please book an appointment to receive your vaccine. All individuals seeking booster dose appointments by walk-in will be turned away. Beginning Monday, December 20th, individuals 18 to 49 years old who received their second dose 3 months ago will be eligible to book booster dose appointments at participating York Region pharmacies, primary care offices, and other clinics on the provincial vaccination portal. Though this may frustrate some in the 18 to 49 age group who are eligible for their booster doses as of today, it is in everyone's interest that our hospital capacity is protected, and our focus must remain on administering the booster doses to those 50 plus and giving children 5 to 11 their first dose. As we ramp up our mass vaccination clinics, we will add vaccination opportunities for those 18 plus at our clinics. Please stay tuned for additional announcements as we reestablish mass vax clinics throughout the region. We appreciate your patience and reassure everyone that we will provide their first, second, or third doses in due course. Last Friday, the Ontario government announced further restrictions to protect Ontarians from the Omicron variant by decreasing capacity limits and limiting social gatherings. We know that vaccination alone will not be sufficient to meet the challenge of Omicron, so these measures are absolutely necessary. Specifically, Ontario has introduced a 50% capacity limit in places like restaurants, personal service settings, gyms, grocery stores, pharmacies, shopping malls, and more. The number of people seated at a table at a restaurant must be limited to 10, with patrons required to remain seated, and bars and restaurants will be required to close by 11 p.m., except for takeout. Unfortunately, dancing will not be allowed, nor will food and drinks at sporting events, concert venues, and theaters, among other places. And lastly, perhaps most importantly, the province has reduced social gathering limits to 10 people indoors and 25 people outdoors. I know this is challenging for families who are looking forward to spending time together over the holidays. It's important that we recognize that transmission occurs when there is close contact between individuals. While many have focused their attention on larger settings, expressing some incredulity at the large venues, for instance, sporting events with thousands of people, it is actually in these many millions of smaller gatherings in homes where the virus truly spreads. These are settings where people are comfortable with one another, remove their masks, and spend a significant amount of time in close contact with each other. With nearly 400,000 private households in York Region, these types of gatherings will continue to contribute to the rise of cases of Omicron in York Region. If you're planning to get together with others to celebrate this holiday season, first, aim for as small a gathering as possible. Second, make sure everyone is vaccinated, including children having at least their first dose, and ideally, those 70 or 50 plus should have a booster. Third, make sure to actively screen everyone for symptoms, even if they are mild. Finally, if you have rapid antigen tests in your household, you may wish to consider using these tests. However, the rapid antigen tests are no magic bullet. We have seen instances where COVID-19 did spread after the use of these tests, so your first layer of protection is small gatherings, masking, distancing, and gathering outdoors. We will continue to analyze transmission information so we can see how best to decrease spread in our community and implement further measures if necessary. Lastly, many parents have questions about in-person learning in the new year. At this time, with things changing literally by the hour, we don't have answers for you quite yet. But we do know that the surest way to contribute to in-person learning in the new year is through ensuring your children are vaccinated. Our clinics have vaccinated well over a third of the 5 to 11 children in York Region, and many are now on their way to being fully vaccinated by the return of school on January 3rd. Our Barry Beachy clinic was a great success, and we have many clinics open for appointments and walk-ins for first and second doses for children over the entirety of the holiday season. We thank you for all you have done during the pandemic and for your patience while we expand clinic capacity in our region. We know you're tired, and so are we, but we can't let our guard down. The virus is nimbler than we are, and it will prey on our fatigue, and it's changing on a dime. We must stay vigilant and do all we can to prevent transmission. Visit york.ca/COVID-19 vaccine for updated COVID-19 vaccine clinic locations and hours. Please stay safe through the holidays.